someone you know.
I know it's truly a feel-good Friday when associates in pediatric therapy come for a visit, because I'm going to meet the patient of the month. You have a chance to do it as well, because this is a time to celebrate the life of Owen, who is succeeding, and he's surpassing all goals, and he's one of those guys who gets things done. But first of all, I want to introduce you to Caroline Scott, who's a representative, I think, marketing director.
That's right. Yep.
For associates in pediatric therapy. So, Caroline, for those who are not familiar with what associates in pediatric therapy do and accomplish, tell us a little bit about it.
Yeah, we offer speech, physical and occupational therapy, as well as behavioral therapy, and we have an audiologist on staff. We also have summer camps, so we kind of cover a lot of bases. In Owen's case, he gets speech therapy with Miss Kayla, and we're all over this Kentuckiana area, also in Lexington. So we try to reach a lot of folks, in the area with a lot of different disciplines. So.
All right. Before we meet Owen, who seems to have no issue with speech whatsoever, right. Justin and Janine are his proud parents, and as they should be. And Janine, maybe you can tell us a little bit about his story. The issue was basically speech, and that was it. I mean, he was very good at comprehension and understood exactly what was going on. But I guess about a year and a half, you discovered, hey, we've got a little bit of an issue, right? Tell us about that.
Around 18 months, we started to get concerned with his speech, because he was such a quiet child, and we had him evaluated through First Steps and was given the diagnosis of apraxia.
And I noticed that you talk about his extended family, people like Miss Kayla, who you will meet in a couple of minutes here, speech therapists, people who care a lot about Owen and really helped him as far as overcoming these challenges, right? Extended family, tell me what that means exactly, Janine.
So it's really, he's in speech therapy 5 days a week, but it's really a joint effort the entire day, anytime you're communicating with Owen, to help him work on his speech. So extended family would be his speech therapist that we work with, grandparents, friends, family, cousins. Everybody's kind of been trained and help us communicate with Owen and help him with his speech.
Justin, I can really relate to you as a father, because I think all of us have challenges with our children. And I want to know, when was really for you maybe one of those epiphany breakthrough kind of moments, and you're going, okay, this therapy is working, it's effective, and I see a difference in my son?
Absolutely. It was when he started to be able to communicate how he felt about his day, just be able to share what he did that day, how it made him feel, whether we were making him happy or sad or mad. It was just good to hear that additional emotion through verbal communication.
Yeah, because it would be tough, because you think you have this happy child, and you do, and he's understanding everything, but yet he's not able to tell you how he feels. So when you finally heard that, and what I hear from a lot of parents is when your child, your son or your daughter says to you, "I love you." Yeah. I mean, now that warms my heart just to hear, right? And when you heard that for the first time from Owen, how did that feel?
It was amazing. I mean, in a way, it was very moving just to hear those emotions for the first time. For him to say that, just maybe one of my favorite moments in this journey so far.
Absolutely. Okay, now you can see Miss Kayla, the speech therapist, is extended family, because he is going from loved one to loved one here. Okay, so Miss Kayla, tell me about your relationship with Owen and how he's progressing.
Oh, Owen is doing amazing in our sessions. He has come so far since we first started. He's a lot of fun to work with. He's always, typically, I can't say always, but typically in a really good mood. He's happy. He's excited to go to speech. He always works so hard for me. So, when we first started, he was able to speak. He was able to say some words, but he has really increased the length and complexity of his utterances. He has really improved his intelligibility, which means how well others are able to understand him. When we first started, he wasn't putting a lot of the sounds on the ends of his words, which can really affect how well you're understood. And he's doing that very consistently now. We still have some, some distortions, some errors, obviously, that we're still working on, still working to build the length of utterances always. But he's done a great job.
And from what I understand, he's quite the basketball player.
He likes to play basketball, and the first time, or one of the times we were playing, he had requested it, and he said something like, "Oh, and shoot from downtown," and I thought it was hilarious, because I had never done that with him, and I'm sure Mom or Dad had played that, and kind of gave him that phrase to use, but he used it very appropriately. He shot from way far back, and he sunk it. So
Justin, I am
funny.
assuming you taught him that.
Oh, yeah.
I'm just guessing here.
I figured.
Owen from downtown, and you say he can shoot. I mean,
he can.
he's quite the ball player.
He made a bunch of a row one day when we were at school, and he was in the gym shooting, and I mean, they were all going in. So.
He seems like a very happy young man, certainly a handsome young man. We saw those pictures up there of Owen. Janine, if you would, tell folks maybe who are facing a bit of a challenge. You went to your general practitioner, your family doctor, and they were trying to do the right thing. They just said, hey, he's understanding everything. He just may be slow to speak. But if you had to do things all over again, would you have maybe seen a professional a little bit earlier, or do you think everything worked out fine?
I probably would have sought it out a little bit sooner, and my advice for parents really is to trust your instinct and get a second opinion. So, you know, we were told maybe just a late talker, it's too early to tell, but, you know, around 18 months, despite hearing that from a family practitioner, we went ahead and sought out therapy services. And really glad that we did, because with apraxia, early treatment is really recommended. So the sooner to start that, the better.
Caroline, for those who are watching, our viewers who are watching, maybe they have a loved one, a grandchild, a son or a daughter who may have some challenges. First step, give you guys a call. Is there a testing process, or what exactly happens?
We have evaluations, screenings, but they would get that referral from their doctor. And like Janine said, we hear this a lot, is trusting your instincts as a parent and listening to your child. But yes, you can give us a call. Our number's on the screen there, and you know, talk to your pediatrician, and we'll go from there.
All right. Owen, it's been a pleasure to meet you. Those are cool shoes. Can I wear those shoes one day? Can I borrow those? Can I wear them?
He's trying.
I don't blame you. I bet I can't shoot as well as you. You'd probably kill me in a game of horse. But Owen, nice to meet you. Congratulations. Janine, Justin, congratulations to you as well. You've got a very a very high-achieving young man there. Associates in Pediatric Therapy. Miss Kayla, thanks for all you do. Always good to see you, Caroline. All right, coming up here, how would you like to win a